okay, we've got this pandemic. Did you narrow down your focus from these 7 or 8 categories down to a handful as a result of the pandemic? And then what innovations did you move through to address the pandemic?
Well, I would tell you one of the key, there was probably two key areas that really helped us immediately during the pandemic. And that was, we were just starting to do virtual medicine. It was really working well within our primary care group. A lot of our specialty physicians weren't really doing it. I think they believed it wasn't really going to be necessary. And then our other was our virtual ICU. And so we had set up our virtual ICU in our main hospital, but really hadn't expanded across to our community-based hospitals. We had plans to, and we were going to do that within the next year and a half, kind of as an overall project. But I'll tell you, when the pandemic hit, we knew that virtual medicine was going to be absolutely necessary, especially when we shut down all of our clinics. And so our technology hub, and it's something that we hadn't gotten to talk about yet, but we created an innovation technology hub. It's within our hospital, within one of our old units that was being decommissioned. So our chief innovation officer is also our CEO of our largest hospital. So when we were talking about doing this, we were thinking about looking off site, and she was like, no, I'm going to let you all have this. So what we did was we took this nursing unit and created what we called our R&D space. And basically, it has a home of the future, clinic of the future, hospital inpatient room of the future, virtual reality room, plus has co-development space within there so that we can work with other outside organizations if we're doing a true co-development project. But what we had to do when the pandemic hit, we had to quickly train all of our physicians to be able to do virtual visits. Well, we already had it set up within our technology hub. So what we did within over a 2-week period, we trained over about 600 physicians to be able, how could they do virtual visits with their patients? What did the technology look like? How would they be able to launch those virtual visits? How would they document overall within our EMR on those visits as well? And then the other piece that we had to do was our virtual ICU. I told you we were planning on expanding it across our organization within a year and a half. Within 6 months, we had it up all over with all in our community hospitals, everything else, plus a virtualized command center where we had hospitalists and different groups who were maintaining and watching over these patients. The other thing that we had to do very quickly was, when in our COVID units, to be able to help our clinicians not always have to go into those rooms, we put iPads in every single one of those rooms so that a virtual visit could be done with that patient if need be, instead of them having to gown up and everything else to be able to just look, get basic information from the patients at the time. But also too, because patient family members could not visit those COVID units, we actually made it possible for family members to dial in and have face-to-face virtual conversations with their families. And so it became just this really nice opportunity so that family members could still communicate with their families that were in the COVID units, if that was possible. We all know if they were intubated or whatever it would be, but before that happened, they could at least have some sort of communication, or at a time when, if maybe the nurse was just in the room and wanted to be able to communicate with the family, with their patient, with their family member.